Hello, I am Valerie Struble, and I am a nursing student with Cedar Crest College, and this is my clinical reflection video for Nursing 335. I will explain how I met the course's objectives in this video. So the first course objective is apply knowledge from previous courses in the physical and social sciences, humanities, and nursing, and meeting the multidimensional needs of individuals and groups within the local geographic area. So as part of my clinical, I did service leadership, where I went to Trinity Soup Kitchen in Bethlehem. I was able to bring some of that knowledge that I learned in 309 and 311, just doing basic assessments in communicating in patient care. Although my main job at the soup kitchen was preparing food and serving food and cleaning and things like that, the people that were there, and they're mainly homeless population in Bethlehem, that they don't necessarily go see a doctor. They're really, not in their best shape, not taking care of themselves very well. They had a lot of questions. I think it's because they knew that I was a nursing student, so they thought that there was the best chance for them to ask some questions regarding, their health. I helped them as much as I could. Obviously, I'm not a medical professional yet, but I was able to go over some, signs and symptoms of things like, just a cold or a flu. Also the signs and symptoms of COVID-19, because this is when we were first talking about it in this country, and basic hygiene and hand washing and caring for, their food and not touching surface areas and things like that. So that's how I met part of this objective. I also did nursing 320. I was a peer leadership with nursing 320 in Bethlehem, Lehigh Valley, Bethlehem. I was able to use a lot of that knowledge that I learned when I did nursing 320 myself, and I helped the students with doing newborn assessments, and I helped them with postpartum care, postpartum hemorrhaging, and signs and symptoms, and medications, and nursing care, and just things that they can look for and things that they can do. And so that's how I met that objective. The second course objective, apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So as part of my clinical, I went to I did the nursing supervisor with Lehigh Valley at Cedar Crest. And that day that I did my clinical was the Sunday before everything was closed. The school was, clinicals were canceled, and Lehigh Valley was enforcing that day the policy of not letting family members have, or not letting patients have family members visiting, or just anyone visiting past a specific time. So they had to, everyone that had a visitor there had to leave the hospital that day. And so I was with a nursing supervisor when she was rounding units and making sure that the nurses understood what was going on, even calling security at times and talking to the doctors who wanted to see if there was a waiver that they could do because a family member needed, or a patient needed a family member to be there for whatever reason. So I got to see how she handled all of it, and her management and leadership skills were pretty great. So I felt really lucky that I was there with her that day, and I was able to learn a lot and meet my objective. The third course objective, evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So I'm going to go back to my nursing supervisor, because this is the perfect example of how I met that objective. Evaluating the effectiveness of communication. She communicated with everyone that day. Everyone that works in the hospital, from cleaning personnel to security to nurses to doctors. And the overall goal in enforcing this policy, where families were not able to visit their loved ones that were in the hospital, the goal is enforcing, is achieving optimal health for the patient, but also for their families. So she had to explain over and over that, that the reason why we're doing this, because people were upset and they were not understanding it or just didn't want to hear it. And so she was really good at communicating and being aggressive when she had to be aggressive and being understanding when she had to be understanding. So I was able to meet my objective that way. Course objective for critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients. So when I did my peer leadership with Nursing 320 students, I was able to critically analyze and integrate leadership research findings in creating their care plans and their case studies. I helped them out, but not using my own information coming just from me, but using information that's gathered from research data that's proven to work. So I help them establish care plans based on actual researched data, and that's how I met that objective. Objective 5, apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. So I think this objective was met throughout my entire clinical. Things like advocacy and teaching and ethics, we do pretty much on a daily basis. When we went to our political legislative day, there are some ethical dilemmas that we can see and talk about. My interprofessional clinical, I did videos where I had to answer questions. And one of the videos was a discussion about preparedness and response during a disaster. And I got to see how in New Orleans, for example, they were using information that some people might not find that ethically should be used to deciding who gets evacuated and who doesn't get evacuated. Things like someone that's severely obese. There's a patient that they decided that should not be evacuated and actually gave this patient a medication to terminate her life because they knew that she wouldn't be able, because of her weight, they wouldn't be able to lift her and she wouldn't be evacuated, but she wasn't a terminally ill patient. So, is that ethically right or is it not? So there's some ethics concerns there that not everyone can agree on. Advocacy, when we are teaching patients, when I was teaching the Trinity Soup Kitchen people about hand hygiene and signs and symptoms of a cold and a flu, I'm advocating for them because I'm making sure that they know what they need to do in order to be healthy and teaching at the same time. So that's how I met that objective. Objective 6, formulate plans for continued personal leadership, growth, and development as an independent practitioner of nursing. So to formulate plans to continue personal leadership growth. So as part of my clinical, I did education on nurse.com. I had to do this because I wasn't able to do physical clinical for continued education because the clinicals were canceled, the face-to-face clinicals were canceled. So I went on nurse.com and did some classes for continuing education, and one of them was about COVID-19 and the signs and symptoms and what to look for and reports on it. And then a second one was an evidence-based approach to pain control. And I wanted to do this one because pain is something that applies to everyone. And it can apply in every situation. So I wanted to have a little bit more knowledge regarding pain control so I can be more educated when I'm taking care of patients myself. And this will help me be a leader and help my growth as a nurse, So that's how I met that objective. Objective 7: recognize the role of the nurse in policy making related to the healthcare services at local, state, and national global levels. So we did our political legislative day in Harrisburg a few weeks ago, where we learned about policy making, in also how it works at the state level and how the bills pass and it comes back. If any changes have to be made to it, it goes back to the beginning and starts over, and just how long the process of legislature can take, to get anything approved and to get anything to pass. And I was really surprised by the amount of time that it can take, and the fact that just one person that may not necessarily agree with the policy, or with the intended policy, the effects of one person can have on a simple policy that they're trying to pass, that can benefit pretty much everyone. So that's how I met that objective. And then the last course objective: predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So this objective is really relevant to what we're seeing with the COVID-19 virus right now. There's a lot of ethical issues regarding what the best way to go about, to make sure that people are healthy and that we're protecting everyone. Social distancing, should we be enforcing? Should politicians, should the president, should government be enforcing social distancing, or do we leave it up to people, because they know what's best, and let them decide and figure it out for themselves? Is it the role of government to enforce a law that is for the better, benefits everyone's health, or is it reaching too far, allowing government to make any decisions regarding, as far as people having to stay home and not being able to leave your house unless it's a life necessity? Is that something that government should have the right to do? Or is it something that people, should be able to figure it out for themselves? There's a lot of people protesting right now because they want to go back to work, and reasons why they want to go back to work is because they don't have food, and they can't, or they don't have money to be able to buy food to be able to feed themselves or their families. And then government telling them that they're not able to go back to work, but also they don't have the means to survive, is really contradicting. So this objective, I think, I'm sure I met this objective, but I'm just thinking about the situation that we're going through right now, and hoping that things will work out for the better. So this was how I met the course's objective. Thank you for objectives. Thank you for listening.